Mashburn, it's me again, and we're going to work on our bone lab. We're going to continue with the bone lab today, and now we're going to talk about the bones of the thorax and spinal column. So we've hopefully covered everything about the skull. You should know your cranial bones now and the bones of your face. So we're going to go ahead and move down the axial skeleton and go over all the bones in your thorax, your ribs, and your vertebral column, your spinal column. Okay, so what we've covered so far, we've covered our skull, done the cranium, done the facial bones. Now we're going to focus on this section today, the rest of the stuff in blue. We're going to do the thoracic cage, which is your ribs, and we're going to do the vertebral column, which is basically your backbone, all the vertebrae that make up your backbone. One bone that kind of doesn't fit in this category, it's a thoracic bone, an axial bone, but it's kind of somewhere between the skull and somewhere between the vertebrae. It's a floating bone. It kind of floats there. This is the hyoid bone. I'm not sure it's spelled on here. H-Y-O-I-D. And the hyoid's right here. It's right near where your larynx is. It actually connects to the styloid processes here that we learned about on our cranial bones. And so when you swallow, that hyoid bone moves and your Adam's apple moves. So that's your hyoid bone. Some people think it looks kind of like a baby mandible because it looks like it's got teeth, but those are just the little horns of the hyoid bone. So if you see something that looks like a little vampire instead of vampire teeth, that is the hyoid bone. And if you're trying to figure out where I am, go to your lab guide. And I'm just going to move right down the sheet of bones. So we're going to do our bones and our bone features as we move along today. So that's your hyoid. Now let's go ahead and move to the bones of the trunk. Now the trunk proper, we're going to talk about our rib cage and our vertebra. And the first thing I want to talk about is basically going to be, let me see, going down my list, the sternum. So your sternum or your breastbone is what we're going to talk about first. And the sternum is originally made up of that's included in the sternum, three bones that fuse together. The first bone is the manubrium, which is this little odd-shaped bone here. It's kind of got several different sides to it. The middle section is the body, and this last little part here that hangs off the bottom is called the xiphoid or xiphoid process. And so those three bones fuse together and make the sternum. You'll also notice that coming off the sternum, you have some blue things. This is cartilage. We call these the costal cartilages, costal meaning rib. And you can see these are the cartilages that connect your sternum to your ribs. So let me talk about a few more things on the sternum. I forgot. Some things that you need to know about the sternum. The manubrium has what's called the sternoclavicular notch and the sternal angle. If you look here and here, so let me take a manubrium and kind of blow it up. It kind of looks like, I'm an awful artist, guys. Like that. Not really. Let me see if I can get my eraser. Hang on there. There we go. Let's start over with the writing. Okay, so on your manubrium, you have some features you need to know about the manubrium. I forgot about that. This is the clavicular notch right here. And here is the jugular notch. And you can actually feel the jugular notch. If you bring your finger and kind of come down your throat, and there's just like a little notch right there, that's the jugular notch. Now the sternal angle, if you'll bring your fingers on down your chest, about right here, you'll kind of feel a knot, like a bump in your chest. That's this sternal angle. And that's actually a landmark. If you're like doing CPR on someone, you'll kind of come down from the jugular notch, feel that sternal angle, and go right below it, and that's where you'll do your CPR, or if you're on the body of the sternum. So you're looking for those landmarks. The other thing you want to remember, the xiphoid process, you'll see it's just kind of this little sharp process that hangs off the bottom. When you're doing CPR, you want to make sure that you're doing the pressure on the body and not the xiphoid process, because it's easy to pop that sucker off and puncture a liver or lung or something like that. So you don't want to break that. All right, so that's pretty much all that you need to know about the sternum. It's pretty easy. It's a bone that originally starts out as 3 bones they fuse together. Now we call those parts the manubrium, the body, and the xiphoid process, and just a couple of things about those bones. We're going to focus now on the ribs. And you'll notice you have 12 sets of ribs, so 24 ribs in all, male and female. There's no difference. We all have the same number of ribs. And we break them into 3 different categories of ribs. True ribs, false ribs, and floating ribs. Now, I'm kind of a purist, and I actually hate true rib, false rib, and floating rib. It drives me insane. I actually like another term, and those are in your lab guide. And so, since you're in my class, you're going to do it my way. So, true ribs are also called the vertebrosternal. False ribs are vertebrochondral. This is going to make sense in a minute, so hang on. And floating ribs are called vertebral. So vertebrosternal, vertebrochondral, and vertebral. Now, the reason I like these terms is they tell you what they are. They tell you where they are. The vertebrosternal ribs, you'll notice these ribs go all the way from the sternum all the way back around to the vertebral column. So vertebra is the beginning of every one of these words. So all the ribs start on the vertebral column, okay? The first 7 pair, 1, 2, 3, 4, 5, 6, 7, come from the vertebral column all the way around and connect to the sternum via that costal cartilage, vertebrosternal. 8 through, let's see, 1, 2, 3, 4, 5, 6, 7, here's 8, 9, and 10. So 8, 9, and 10 are your vertebrochondral. So 8 through 10 are your vertebrochondral. Again, they start in the vertebra, and they come around, and they connect. They don't connect directly to the sternum. They have to connect to the cartilage of number 7. So vertebrochondral, because chondral means cartilage. So you'll know that 8, 9, and 10, don't do it 8 through 12, 8, 9, and 10 are your vertebrochondral ribs, and your floating ribs are 11 and 12. Vertebral. They just come around to nothing. There's no connection on the front. So if you'll learn them as 1 through 7, vertebrosternal, you'll know those come from the backbone all the way to the sternum. 8 and through 10, vertebrochondral, come from the backbone all the way to the costal cartilage of number 7. And then 11 and 12 start from are the vertebral ribs. They start in the back, come around to nothing. That's an easier way, I think, to learn it. So those are your ribs. Now, of course, we've got to know something about those ribs. Remember, we're going to learn the bones, and we're going to learn some features. So here's a rib, and the features you need to know is the head, and this is basically the end that connects to the vertebra. This little thin area here is the neck. You have a tubercle here, and anytime you see the word tubercle, that just means a bump. Okay, tubercle just means a bump. Then you have this long shaft, and where it kind of bends around is called the angle. And you have this long shaft. And then you have this flat end, which is where it articulates with the costal cartilage. So this is a rib, so you need to be able to recognize the head, the neck, the tubercle, the shaft, and this costal end. Now, it's hard in a picture to figure out left and right ribs. I'm going to try to show you using this picture. If you watch Ms. Graham's YouTube video, she's kind of got 2 side by side. You can kind of watch how you can tell left and right ribs. But what you want to know is the head of the rib, okay? It articulates, or joins. An articulation is a joint. So if someone is an articulate person, that means they speak well. That means they join words together very well. That's where the word comes from. So the articulation, or the joint, between the rib and the vertebra occurs right here, okay? And then you have the little tubercle is basically what joins that part of the vertebra. And we're going to show you that part of the vertebra in just a minute. The rib comes around as a shaft and then joins the costal cartilage onto the sternum. Now, if you were looking at this one, here's your backbone, here's your vertebra, this is the anterior side of your vertebra, This is the posterior side. So this one is actually a right rib. Alright, so that's all you got to know about ribs. Just be able to recognize the neck, the head, the tubercle, and know that the true rib, vertebral sternal, false. That's why I don't use true, false, and floating. It drives me crazy. Vertebral sternal, vertebral condyle, or vertebral. Okay, moving on from that, we're going to go ahead and go to the vertebral column, which is basically your backbone or your spine. And so, why do we even have a backbone or a spine? The main thing is it holds you up. It's basically your big support system. It supports your weight. It surrounds and protects the spinal cord. And because it's kind of got this nice curve, if you send the video on curves, it acts as a shock absorber, so it helps to kind of take impact as you walk. When you look at the vertebral column, you have basically 1, 2, 3, 4, 5 different types of vertebrae that make up the vertebral column. And you have 26 of these. Irregular bones have an odd shape. And there are 7 cervical vertebrae. There are 12 thoracic vertebrae. There are 5 lumbar. There's 5 fused sacral, but it makes just 1. Okay, so 5 originally, they fused to make 1. And then 4 fused together to make the coccyx. Now this is an anterior view, so this is like you're looking at me and you can see through me and you can see my backbone. So this is looking at it from the front, and so you have kind of these smooth rounded edges on the front. If you turn it to a lateral view, looking at the side, you can see the curves. You can see this is the anterior side, this is the posterior side. And then flip it all the way around to the posterior side. You can see this is where you have those little spines. So if you run your finger down your backbone, you can feel those bumps. That's what you're feeling, these little spines on the vertebra. Also, between each vertebra, there's a piece of cartilage. Remember what kind it is? Fibrocartilage. Which is the discs between each vertebra. And there's also a little space where these vertebrae articulate on top of each other. They make a hole. What's the hole of foramen? This is called the intervertebral foramen, so between the vertebral holes. And this is where spinal nerves come out. So your spinal cord is running right down the center of your vertebral column, and then the spinal nerves can come out, not in the body. The spinal cord's more like through here, sorry. And the spinal nerves are coming out through the intervertebral foramen. Let's see what else I want to talk about on that picture. Oh, I know what I was going to talk about. So 7 cervical, 12 thoracic, 5 lumbar, 1 sacral, 1 coccyx. For some people, they use the mnemonic breakfast, lunch, and dinner. You eat breakfast at 7, lunch at 12, and dinner at 5 to remember how many of each one there are. The way you name these vertebrae is based on their number. So you just start from the very top, the most superior vertebra, and you name down, you count down. So the top one is C for cervical, C1. The next one is C2, cervical number 2, cervical 3, cervical 4, C5, C6, C7. Once you get to the top of the thoracic, it's thoracic 1 or T1 all the way through T12. Then you get to lumbar 1 or L1 through L5, and then sacral and coccyx. Now, one thing to remember, you kind of get confused on, how many thoracic vertebrae are. You can kind of cheat. Every thoracic vertebrae has a rib coming off of it. And how many ribs do you have? 12 pairs. So you have the same number of thoracic vertebrae that you do ribs. So every time you have a rib, you have a thoracic vertebrae. Okay. Got a lot of notes here, so I'm just trying to make sure I don't miss anything. Alright, so this is just a general picture of those different types of vertebrae. I want to kind of show you that they all look different, but by the time you've gone through this course, you'll be able to look at one of these and know where it's from. Okay, know which part of the spine it's from. You'll know if it's a thoracic vertebra or a cervical vertebra or a lumbar vertebra. I can tell you just by looking at them. This one, and this one. The top 3. These are all cervical. This is a thoracic. This is a lumbar. Now, just looking at those, you're thinking, how does she know that? Well, there's some things you want to look for. The first thing, see these holes? Only cervical vertebrae have those holes, and those are called transverse foramen. And there are some here. You just can't see them. They're kind of hidden. So anytime you see these little holes off to the side, this extra hole, that's a transverse foramen. That is a cervical vertebrae. If you see a big chunky bone, it's just a big thick bone, that's a lumbar bone because that's holding all that weight. All your low back is holding a lot of weight, so they're big thick bones. And then thoracic bones, not so big and chunky, but they have a long spine. And if you look back at this picture, you'll notice all the thoracic vertebrae kind of have a long spine. So that kind of tells you what to look for. And we'll do this one vertebra at a time and kind of show you how to find it. This is just a general vertebra. And I want to show you some specific things that you can look for. This big chunky part, okay, the most anterior part. This is the body. Right behind that, or just posterior to that, is a hole. That's the vertebral foramen. All vertebrae have this body and have this vertebral foramen. This is where the spinal cord is going through. Coming off to the sides, you have these processes. Well, if it goes off to the side, what word means side? Transverse. So these are your transverse processes. Coming off the very back or posterior side, you have a process called the spinous process. And you don't need to worry about the lamina and the pedicle. We're not going to really talk about that. Now, you also have some facets. And facets just means an articulation point where another bone can connect to it. You have superior and inferior facets, which basically that means where the vertebrae fit on top of each other. And then you have some rib facets here, like on the thoracic vertebra. That's where the ribs would fit under the thoracic vertebra. Again, you kind of need to look in your book. If you've got that black and yellow spiral notebook that came with some of your textbooks, great bone pictures in there. You're welcome to look at that to help you identify some of these processes. Use your book, and again, watch Ms. Graham's YouTube, and she'll be able to kind of turn it in all different directions and show you those processes as well. All right, so here is a blown-up view of one of our models in the lab. I just want to kind of show you. Here's those intervertebral discs. Here's the vertebra. This is the anterior side, the posterior side. You can see that hole. This is the intervertebral foramen where the spinal nerves come out. So it kind of gives you an idea of how all that looks together on the model. Okay, so we're going to cover the cervical vertebra first, okay, and talk about how you can identify the 7 cervical vertebrae and anything in particular or unusual about any of them. Now, C3 through C7, they look just the same. Okay, if I gave you a C3, C4, C5, C6, C7, you probably couldn't tell which one it was. You would know it was cervical, you would know it was 3, 4, 5, 6, 7, but you might not be able to know exactly which one if I just handed it to you. I can't tell either. So if you see a cervical vertebrae, it should look something. Let me go back to my picture. C3, 4, 5, 6, 7 all look like that. Okay? C1 and 2 look very different. They are very different, and you can tell those apart just by looking at them. This is C1. This is C2. Okay? The main difference, C1 is the only vertebra that doesn't have a body. It's got a big hole there. There's no body there. C2 has this really, really big body called the dens. Dens like dental or odontoid process, like orthodontist means tooth. So it has a tooth on it. So let's go forward. And you'll see, this is the C1. Now C1 has a special name. It's called the atlas. And if you go back to your mythology, there's a story about Atlas holding up the world. Well, this is your world. Your head is your world, and your atlas vertebra, your top vertebra, is holding up your world. So that's basically why it's called the atlas. And so on a test, you can call this vertebra C1 or atlas. They're the same thing, and everybody knows what you're talking about. So here you can see those transverse foramen. There's no body. There's no body there, so it's kind of space there. And there's not much of a spinous process. It's kind of smooth. It's not real bumpy on the back of your neck right there at the top. So there's not much of a spinous process there. If you move down to C2, we call this the axis. So the atlas and the axis. The atlas sits on top of the axis. Where that body is missing in the atlas, this dens or odontoid process basically fits up into that little hole. And an axis is something that pivots, okay? So your head is allowed to pivot. So there's two important joint motions that you do with those two vertebrae. Your head, remember those occipital condyles that are next to your foramen magnum on the bottom of your skull? They fit right here. Those occipital condyles fit in these little fossa here. Remember, fossa means depression, and it allows you to say yes, okay? When you put the atlas on the axis, so the little dens fits up inside the axis, in the atlas, you can make the no movement. So those are two important movements based on those two vertebrae. Alright, you also notice on the cervical vertebrae, if you go 3, 4, 5, 6, 7, they have that transverse foramen. They have a spinous process. There's not much of a spinous process on C1 and C2, but C3 through C7 have noticeable spinous processes. And the spinous process ends in a little Y, and we call this a bifid. Like bifid, that's a D, sorry. Like spina bifida, there's kind of an incomplete closure during the formation as the bone kind of wraps around the spinal cord. It doesn't quite close right. And so that's what spina bifida is. And so this bifid process is this little fork, bi meaning two, process on the back of your cervical vertebra. So if you see a vertebra with a transverse foramen and a little Y on the back of the spinous process, it has to be cervical. And I won't ask you to tell me if it's C3 or C4 or C5 or C6 or C7. I just want you to know that it's cervical. You just have to identify C1 and C2 by name and number. Alright, so the next set of vertebrae are your thoracic vertebrae. Remember, these are in your rib cage, so these are the ones right in your thorax, in your thoracic cavity. There's a rib associated with every one of them. They have a long sinus process. They all have a body. And there's really nothing, to me they look like a giraffe, and that's what I always tell my students. Look for the one that looks like a giraffe. Kind of got a long, skinny neck, kind of a face and some ears. Looks like a giraffe to me. They do have these little pits on the transverse process. It's called costal facets. Costal means what? Rib. So this is where the rib attaches. So if you see something with a long process, like a flat little face and some ears, that's the thoracic vertebra. The last ones are your lumbar. And there's 5 of those in your low back, and they're big, thick, chunky bones. They're just really big, thick. Again, a short spinous process. Let me go to the side. Short spinous process, big, thick body. Looks kind of like a hippopotamus. Okay? Big, big head, little bitty ears, kind of like a hippopotamus. So that's how I remember it. That's the way I learned it. That's the way I remember it. Now, one thing you need to make sure that you understand before I move on is what's the top of a vertebra and what's the bottom of a vertebra. So if you see one on a test, and I'm asking you, are you looking at the superior side or the inferior side, which one's which? What you want to do is you want to look at this spinous process. The spinous process should always be below the transverse process. Okay? So if on a picture you saw a vertebra that looks something like this, and a long spinous process, this is a transverse process here, transverse process here, and the spinous process is pointing up, it's upside down, okay? So this would be the inferior surface, and this would be the superior surface. All right, so just kind of get an idea, if you look at a vertebra, the spinous process is always going to be below the transverse process, and that's your correct orientation. All right, now your sacrum. This is looking, if you're looking at somebody straight on, you're looking at the anterior side of the sacrum. This is the sacrum. This is the coccyx. Looks kind of like a rattlesnake tail. You'll see originally it was 5 bones, 1, 2, 3, 4, 5, that have fused and you have these little foramen that are left. And this is where your hip bones connect to your body. So this is a joint place for your hips, your appendicular skeleton, your hips, your pelvic girdle, to join your axial skeleton, to join your backbone. Anything? All right, so you're looking at the back side now. So now you're looking at the back of the sacrum, your posterior side. And there's these little flat areas here. This is the articular surface. This is called the sacroiliac joint. So the bone of the hip is called the ilium. So where the ilium and the sacrum come together, so here would be my big hip bone over here, and it would come and join there. This would be the sacroiliac joint, and I'll show you that again when we talk about the hips and talk about the hip bones, the pelvic girdle. But where the two hip bones join the sacrum is your sacroiliac joint. One of the reasons it's called a sacrum, and I always kind of tell you this just because I think it's interesting, if you've ever been to Europe or seen an old church that has what's called a flying buttress, which means you've got a church, let's put a little church here, there's our steeple, and they've got those kind of things that come off the side, those wings, that help hold the walls in those old Gothic churches before they knew how to stabilize the walls. They would put these things called flying buttresses on the walls to keep the walls from falling down. And so that's kind of what this looks like. Or whoever decided to call the sacrum thought it looked like that. So sacrum means sacred. So that's where it gets its name. It looks like a church. And again, one more thing, this is going to be the superior side. So this is going to be with the last lumbar, which is L5. L5 is going to sit right on top of the sacrum. And then you have your coccyx, what you call your tailbone. If you fall and break your tailbone, you usually break your coccyx. That it? Yay! Okay, so that's all we're going to talk about for the thorax and the vertebra. I'll see you again next video. We'll talk about the pectoral girdle and the arms, and we'll talk about the pelvic girdle and the legs. Good luck. Keep studying.